next shoe to drop is? What happens if we stop some of these mitigation efforts? If we try and open up and go back, are we going to see big outbreaks again? That's the question everybody's trying to answer right now.
Right. Well, I think we're going to open up in May. We're going to gradually open the economy. I think we're going to do it in a responsible fashion where we do it in stages. And the summer hopefully is a backstop, as we've been saying, that when you get into the deep summer, July and August, June, that's going to be somewhat of a backstop against transmission. Both droplet transmission isn't as efficient in the hot, humid weather, and the epidemiology of spread changes in the summer when people are outside more. I think the risk that we have to be worried about is the longer term. What happens if we come back in the fall? What summer is quiescent, and then we come back in the fall, and then there are outbreaks again. And what do? You're seeing a resurgence in cases in Singapore and Hong Kong right now, and Singapore has reached back to their mitigation steps and started to shut down aspects of economic life in Singapore. They've closed the schools, they've closed transport as a way to now mitigate what is a bigger resurgence in cases and what the first wave looked like in that country. So this is going to be a pathogen that's with us until we get a vaccine, until we're able to vanquish it. And we need to learn how to live with it and how we have to change aspects of our life, hopefully in ways that aren't too intrusive, to mitigate risk on an ongoing basis. There might be some things that we just don't do or we're more careful about doing because there is going to be a risk that this comes back. It wants to come back in the fall. This is a very contagious pathogen, and it probably is going to be a seasonal component to this. It is going to want to come back in the fall and winter.
I think that may be the most confusing aspect of things. Even this idea of social distancing, of people, are you allowed to go on a walk with friends 6 feet apart? Are you allowed to hang out and talk to people? How can your kids hang out with their friends? That was difficult enough to try and get everybody to the point where we all agreed, okay, we're not going to do that for a while. Once you start opening this up in stages, I think it really raises all kinds of questions about what's safe and what's not. When you say we're going to change things, does that mean we don't go to big basketball games or big football stadiums and kind of watch any of these things? Does that mean my kids don't play sports when they go back to school? I mean, what are the levels you're talking about? It mean that we don't hang out with my entire extended family, especially my parents who are older, once we're looking at the holidays again?
I think it means we're more careful. And I think a lot of the things that we're going to do just on a routine basis, no handshakes, washing our hands, reducing our travel where we can, not taking unnecessary trips, all that's going to have an impact on the epidemiology of spread. It's going to reduce spread. It's going to reduce the transmissibility of this. And I think people are going to come out of this, sufficiently concerned about the spread of this virus that it is going to change behavior in ways that are subtle for everyone, but aggregated on the whole is going to reduce the risk of spread. Probably the risk right now of spread, because we're declining, we're beginning to decline, is a lot less than the risk was, say, in late February or early March when we didn't think there was a big epidemic, but in fact there was, and people weren't taking these kinds of precautions. Now we're at a point where people are being much more careful. So that's going to mitigate the risk that we all face. But, this is going to be with us. This pathogen is going to be with us. I'm hoping that we have a better toolbox in the fall in terms of much better surveillance and testing so we can spot outbreaks when they're small. But hopefully one or more therapeutics that can help rescue people who become ill, who show up in the emergency room to mitigate, the most severe impacts of this virus. It's not clear we're going to get that. It's going to be hard to develop those in the summer as cases are declining. It's going to be hard to enroll those trials. But I'm hopeful we get it. There was an interesting study, final point, there was an interesting study yesterday in the New England Journal of Medicine of women who presented for delivery in New York City in one New York City hospital, where they found 15% of the women were positive for coronavirus. That's a very high percentage. And what it suggests is that in these hotspot cities, the overall exposure might be quite high. While overall in the United States, the exposure to this and the level of immunity is probably in the single digits, below 10%. When you look at hotspot cities like New York, Miami, Detroit, Chicago, Los Angeles, the overall exposure might be quite high. So you might have a little bit more immunity in those cities.
Right. Hey, doctor, just back to Becky's question about kids and grandparents and things like that. When it comes to even this summer, when assuming we're not quarantined or staying at home ourselves, but we're going to work and maybe wearing masks and gloves and trying to be careful, and maybe our kids are going to the park or I don't know what, but I guess the question still remains, given the risks that exist, would you let your kids go hug their grandparents?
Yeah, look, I think those are the kinds of things people need to contemplate very carefully, being careful with people who are at a higher rate of bad outcomes, people who are older or immunocompromised, have medical conditions that would predispose them to a bad outcome here. But we're all going to have to, start living our lives again. I think that we're going to do things to be careful, wash our hands, take our temperature, make sure people aren't sick, even mildly sick, get tested when we think we might have signs and symptoms of coronavirus. All of those things are going to mitigate spread, but we're going to go back to living our lives. And I think that hopefully
Doctor,
July and August are quiescent.
Do I not have...
Yes.
Doctor, what's the calculus, though? You're the doctor. So I'm asking as just a person who wants to know the calculus on whether the kids can actually go. You can not only go into a room, but actually have physical contact with somebody who's, let's say, over 65 or 70 years old. How do you even think about that?
I'll tell you what.
What would you actually tell your own family?
Right. So I'll tell you what my calculus is going to be. If I'm reasonably confident that this isn't spreading at epidemic levels, which I hope we will be in the summer, I think we will be, and my kids are otherwise fine, they're healthy, they don't have temperatures, they don't have colds, I'm not going to be concerned about them being around my parents who are older. I'm going to let them, play with their friends, interact with older adults, but I'm going to be more vigilant to make sure that they don't have colds. If they do, then I'll probably keep them away because we know there's asymptomatic and mild illness here that could spread.